Anxiety can be a number of different conditions. It can be basically excessive worry about realistic things that could happen, like potentially losing one's job, getting an illness or sickness, maybe too many bills coming in, or kids' behavior problems. So realistic things, but excessive worry and preoccupation about what could happen next, excessive worry, or it can be in the category of what we call panic attacks, where your heart's racing, you're nervous, you feel like your palms are sweaty. You might even believe that you're having a heart attack. Some people in that condition might even go to an emergency room because they think they're dying. They feel like their body's losing control. And it might get so paralyzing to where the person with panic anxiety might even have what's called agoraphobia. In that condition, they stay at home. They don't even go around people. They don't even manage to go to the grocery store, the bank, school, a job. So anxiety can be disabling. There's many types of anxiety. As I said, there can be panic anxiety. There's also people with anxiety called post-traumatic stress disorder. Now, a lot of people think of that as the Army war vet type of disorder. And it could be. It's any time a person's faced something that has been traumatic, where they've either had their own life threatened, witnessed some type of violence or severe situation that was perceived as traumatic to them, or they've witnessed someone else in a trauma. Someone with post-traumatic stress essentially relives that situation again as if it's happening in the present. So for example, in the case of the Army War veteran, maybe they're no longer on the battlefield and they finally, thankfully, come home to their spouse, but little stresses like seeing maybe something reported on the news about gunshots or gun rights might take them back to the battlefield, to the people they've seen blown up, to the situations that they've witnessed. So that also could happen in the case of people maybe who've been raped, or maybe kids who live in a violent neighborhood whose mom or dad was suddenly shot, or they're maybe living in a gang-ridden area. There's other types of anxiety disorders as well. There's people who pick their skin when they're stressed out. They may pull their nails, they may pull their cuticles, they might pick the hair off their arms or off their head. I've even seen patients to the point where they've had holes of no hair on their head because they were so nervous or anxious. Some people may become anxious to where they have what's called acute stress disorder, which is a shorter period of time than the person with post-traumatic stress, but essentially the same symptoms. They're just afraid of when the next trauma or abuse is going to happen. There's also something called generalized anxiety disorder. This one is excessive worry about typical life situations. Basically, the person fears that if an unforeseen event happens, they won't be able to handle it. They think, what if all the time? What might happen next? And of course, they're anticipating the most negative of situations. Even though they might have life skills that they've already developed to handle stressors, they still feel like they're not going to be able to handle the next thing. The next thing might be worse or might be more stressful for them. And some people in the worst of anxiety even develop things like dissociative symptoms. What I mean by that is what people used to call multiple personalities, where they kind of split and become several different people, quote unquote, at once, where it's just so hard for them to integrate all the stresses of life that they develop one, quote, personality or way of dealing with things for the trauma they had as a kid, another one to deal with another life issue, or another one to deal with another section of life. So anxiety has to do with sometimes the worrying mindset and preoccupation, or it can deal with the panic and just the state of my body's out of control. And finally, another type of anxiety is called obsessive-compulsive disorder, With that type of anxiety, someone becomes so preoccupied with something that it's like a repetitive, vicious cycle, almost like a record player playing over and over the same message. If you've ever heard about people who count over and over, maybe they need to do a behavior 10 or 20 or a certain magical number of times. Maybe they count or check things. Maybe they've been abused and they feel unclean, so they wash their body over and over and over. Not just a few showers a day, but maybe 20 times to where their skin's bleeding and it's dry and it's peeling. I had a little girl once I met with who was so much having the obsessive-compulsive traits that the girl spent a half hour at a time squirting the liquid soap on her body to where her little hands, as young as she was, were peeling off, and she just felt she couldn't wash enough. So the obsessions are the thoughts that people just can't get out of their mind. And they're usually intrusive thoughts, things that come upon them about being unclean, or about if they don't do things the right number of times or exactly perfectly, then something awful is going to happen. So in response to that, they do compulsive behaviors like hand washing or checking or counting. Anxiety is very disabling, and anxiety, just like depression, is number one or number two of the things in the mental health field and among average Americans that they face. It's something we definitely need to deal with, that we can't ignore. It's like a plague or an epidemic, frankly, among average everyday people, to where it's become easy for people to anticipate the worst and hard for them to see the bright side of things. It's easier when they ask what if and what next to assume it's going to be bad again, to remember the bad things of the past, to become preoccupied with what might, whether it happens or not, happen next. So that's where anxiety comes from. Preoccupation, fear, heart racing, bad memories, anticipation of a bad future.